Welcome everybody. I'm glad you've joined us. And for those of you who don't know, I'm Jessica Mcilveen, the founder of Kids Yoga Therapy. And if you haven't already tuned into a few of my interviews so far, I've been interviewing amazing people, one with amazing stories to tell, and two, incredible professionals that work with the children that I also work with. So children with special needs, children that are at the effects of trauma, so that's abuse and neglect, children that experience intense anxiety. And what I'm really wanting to bring to you is a lot more tools for your toolbox, for one, and also the language. I really want us to be able to understand what our children are experiencing from their world. And unless we have the language to put to that, we can often remain in the dark. And if that's the case, then so does our understanding of our child and how to help them. So with no further ado, I have Deb Bone here from DV Therapy. Now, Deb is an OT. She's been practicing for about 27 years now with children and currently works out of her own private practice in Redcliffe. So she's going to be here enlightening us with many great, a lot of great information, really. So thanks, Deb, for joining me, and welcome.
Thanks for asking me. I appreciate it.
Yeah, thank you. So I'd love everybody just to get to know you a little bit, Deb. So why don't you start off by, I guess, a little bit about yourself, whatever you feel like sharing, where you've come from, how you've come to be the person that you are today.
Okay, that's quite a question. Look, I mean, I think that probably to get a bit of a gauge of what sort of person I'm like is the fact that I just love what I do for a living. And I don't say that in a sort of cliched sort of way. It's actually true. I love what I do. I have been branded a bit of a workaholic, I should say, and I just tend to work quite a lot and love it so much. And I get on I actually get quite a high of that once I've had a really good clinic day. Mm-hmm. And just the changes that I make with kids on a daily basis. So I got into pediatrics when I was in the United States back in 1994 by accident. I never thought I would be in pediatrics. I thought, I'm not working with children, no way. I'm going to work with adults, and that's the truth. But I just got burnt out in the United States insurance system, and a friend of mine suggested to me, why don't you try the school system? And I thought, okay. So I gave it a go, and I just found that I absolutely loved it, and I found it came to me very easily, and I could see differences with kids very quickly. And then I became very interested in sensory processing difficulties. Mm-hmm. And when I came back to Australia back in 2000, I found there was a real gap in the market where kids weren't being supported the way that I felt they were supported in the United States, that the Australian system was very different, that kids in the school systems that had a lot of major difficulties were supported, but kids that had milder difficulties weren't. So kids that we see now today, and you see as well, Jess, kids who have ASD, sensory processing disorders, ADD, learning difficulties, motor delays, things like this. This is what I found to be the gap. And so I started my private practice back in 2001, and I've been pretty much busy ever since. And I guess, I love to see people, particularly children, become the best versions of themselves, and to feel amazing. Things came quite easy to me as a kid, and when I started to see other kids struggle, my heart just went out to them, really. And, I get paid to play. I have a great time with the kids that I see, and I help them regulate themselves, really. I help them with their motor skills, with their ability to focus, deal with their emotional issues, overall coordination, and just social skills and confidence and things like this. So it's something that I love to do, and I'm a bit of a go-getter. I tend to sort of live on the edge a little bit. I jump out of planes, I swim with whales, I ride my motor scooter. I just love to do lots of different things, and that, I think, comes across in my passion with what I do with the kids that I see. I guess for me, in a nutshell, I'm just, I don't know, I suppose I'm just a bit of a go-getter, a bit of a a mover and a shaker, I suppose. I just love to get out there and enjoy life, and I want kids that I see to enjoy life too. So, and I also passionately love my dog as well, Waffles. He's part of my practice as well. So I just thought I'd add that. Love the beach.
Don't forget the pooch.
That's right. Love traveling. But my main thing is I love the work that I do, and I still have to pinch myself sometimes to realise I'm actually doing something I really enjoy every day. When it comes to Monday, it's fine. It's like, great, I'm back to work. Great, okay.
Perfect.
So, me in a nutshell. Yeah.
Yeah. What a great way to live. And Deb and I, we met at the Sunshine Coast ADHD conference back in October last year. And that energy that you're speaking about now and your passion definitely came through in your talk, but also when we were talking as well. So I definitely feel that from you, and did back then too. So Deb, I'd love to know what children are you seeing? What children come to you and that you work predominantly with?
Yeah, a lot of the referrals I get are kids that have just been diagnosed with ASD, or autism spectrum disorder. Mm-hmm. A lot of the kids actually now come to me with that. But I guess on the whole, and I would say 80 to 90% of my caseload are kids that have a diagnosis with ASD. Saying that, though, I also have a number of children that come in with anxiety difficulties, behavioural concerns that are actually stemming from difficulties with learning, with regulating themselves. And when I actually look at things, they've got difficulties with sensory processing. So that means that they're perceiving things in their world differently from what you and I would perceive. So, for example, there was a storm here the other day, and the child that I was seeing really struggled with it because of the noise. So we had to put on some noise cancelling headphones to dampen that. So they're the sorts of kids that I do see. I even get referrals for your traditional handwriting difficulties, motor planning difficulties, fatigue issues at school. Okay. Kids that are just struggling with fitting in and learning overall. I think because I've been around for so long, they seem to sort of send them my way first. And I'm like, okay, this is what's going on, and then I can refer out.
Okay, all right. And I guess when families first come to you, Deb, they've got a child now and they've just been diagnosed, and parents can respond in a few different ways. It can be very much, a grieving process. It can be a sense of loss. It can be a sense of despair, feeling quite lost as well, and sometimes feeling relieved. So that's definitely there for some parents. So what is it that you see among parents quite often when they come to you? What's their main concerns, do you think?
Yeah, I think they want answers. They want to know what can they do to help their child. I have a questionnaire, and when kids initially come in and parents fill it out, and I ask them what is their hope for therapy. And a lot of the time they'll write down, I just want my kid to be able to cope better and not have problems at school. So they just want answers and what they can do. And they also want to know if they need to see other people, and whether they need to see a doctor or they need to see a speech pathologist or someone like yourself. And they also want to know how long this is going to take. Is it going to go away? They want to know everything. But they're the main things. Are we going to be okay? Is my child going to function in this world independently, really? They start to look at the whole picture. And a lot of some parents come in, they just start crying, because it's all that grief like you talk about, Jess. And I just, I break it down to manageable sorts of bits that we go, okay, let's work on this for a while. Let's deal with that one thing at a time. We've got plenty of time. We'll get there. We'll be okay. And more often than not, once they leave the clinic, they know that they're going to be okay. They've got someone to support them and stuff, and they know what's going to happen in the future and how they'll get there, really. Yeah. So that's pretty much when they come in. Perfect.
That support's really important. Absolutely.
Oh, I think so, yeah. They feel lost, certainly, and that's understandable, because some parents, their kid's just been diagnosed, they knew something was going on, and they're just like, well, what does all this mean? I've been given this funding. What am I supposed to do? You know,
Sure.
I don't care, you know, and they want to know how to relate to their own child as well, you know.
Yeah.
Without butting heads all the time too. So
exactly. And
any
so
questions?
for these children, when they first come to you, Deb, what exactly, actually we might start with children that haven't come to you yet. So some parents, you know, they have this deep knowing that something might not be okay, and they're questioning, do I need to see somebody? How can I support my child better? Is this something I should be concerned about? So when we're discussing sensory issues and overload and not processing, you know, our environment in a healthy, okay way, what should parents be looking out for? What are your top tips in that scenario?
Okay, I think that if you're seeing your child over-respond to a situation that you would normally not respond to. So, for example, if you're at the shops and they can never regulate themselves at the shops, okay? They always go into overload. It's a drama. That's a big one. Shopping centres. Also, too, if they don't want to go anywhere. They're just like, no, I don't want to go anywhere. I don't want to do anything. I'm going to stay right here where it's comfortable and I can control my whole sensory environment. If your child is very anxious and not really sure about what to do because they're not sure what information is going to come in and how are they going to deal with that and process that.
Sure.
So, yeah. And also too, I think if kids are constantly or consistently getting into trouble at school for things that you're really surprised about, like if they're okay at home and they get to school and they're sort of losing the bundle, or vice versa.
Yeah,
they're fine at school and they get home and as soon as they see you, they just have a meltdown, you know, and the teachers might be like, no, it's all good, and you're left wondering, well, why are they like this at home?
Sure.
It's because they've got a sensory processing difficulty. They're keeping it together until they've got an opportunity to let it all out when they get home. Okay, it's not because you're a bad parent or anything. It's just this is how they're recovering from the situation. Okay, so they're probably the top things, I suppose. And not wanting to be around crowds and stuff. New environments they freak out about. They don't want to go to birthday parties. No friends at school, stuff like that. Having difficulties like this. So they're the things to sort of look out for, I suppose. Lack of eye contact. I could go on and on, but they're probably the main things, I'd say, Jess.
Okay. And I guess my next question to you, Deb, is if we see these things in children, does that necessarily mean there will be a diagnosis? Or is this something that we can just support our child with without going down that path?
Yeah, absolutely. Kids that have ASD will always have sensory processing difficulties. That's part of the diagnosis there, but over-respond to information or under-respond to it. So they're seeking sensation or losing it, basically, in layman's terms, I suppose. But there is a large majority of children that just because they have sensory issues, they don't necessarily have ASD or autism or Asperger's, whatever you want to call it. They might just have they just need some supports to get them through. They might just need to have some noise cancelling headphones, have some compression shirts, involve themselves in activities that assist with breathing. For example, like your yoga stuff, like if they're doing some breathing activities, some movement activities that provide deep pressure and rhythm and deep breathing. These are the sorts of things that they might just need to be able to regulate themselves. So it may just be a sensory processing difficulty that they need to be supported with. Also that may just be due to the sensory processing difficulty may also cover a little bit of anxiety that's going on too. So when that reduces too, and the sensory stuff is being supported, then kids will improve and actually cope much better. And more often than not too, kids that have ASD will become less like their peers as they get older. Kids without ASD will become more like their peers and will be able to regulate themselves without having to have further diagnosis or medication or anything like that.
Sure.
So, yeah.
Okay.
And,
All right.
yeah.
Yeah, I think that's important to know, because not often, it doesn't always lead to one avenue of diagnosis. You know, sometimes the children just need, as you say, a little bit of support in one area. And we also need, every child is completely different. So it's okay that they're a little bit shy at a birthday party in the beginning and they need to warm up a little bit. You know, we really need to, we don't always need to see a diagnosis when we see a behaviour that everybody else is not exhibiting. It doesn't mean anything sometimes.
That's right. And,
yeah.
you know, if I can quote Professor Atwood, he said, Tony Atwood, who's the guru in Asperger's and ASD, he did say that, and I think this is correct, he did say that diagnosis is not about judgment, it's about being supported. So also, I don't want parents in general to feel that just because someone has suggested to see an occupational therapist or yourself or someone, it doesn't necessarily mean I want them diagnosed, they have this. Unfortunately, some professionals or some people can go out of their realm and say, I think your kid has ASD, and they don't know what they're talking about. And really, I guess the take home is, don't be afraid if someone says go and see an occupational therapist like myself, because really it's just about investigation and support. It doesn't necessarily mean that you're going down the road of having your child being diagnosed as autistic. You know, that's not necessarily the case. And you know what? Even if it is the case, that's okay too, because we're all different, you know. It just means we can be supported the right way and be understood, you know.
That's right. Exactly.
Yeah. Be understood. I mean, I could go on and on, Jess, but I won't.
Yeah.
At the time, you've probably got some other questions.
I could tell, and that's where your passion comes through. That's right. So I guess let's talk about the two main diagnoses that I work with and that you probably work with too. So mine is definitely ASD and ADHD.
Yeah.
They're two really main ones. So if we can start off with ASD, and if you feel like you can combine them at any stage, then please do. But so if we start off with ASD, so we've got over-responsive and under-responsive quite often in these children. So what is it that is really the stuff that parents can be doing within the home to support the child in either of those categories?
I think that the best way to start dealing with that, because it's a very general sort of question about all different types of sensory profiles, really.
Yeah.
The main thing is the key is to start being aware. Mm-hmm. Kids need to start being aware of whether they, and this is one thing that, which is mine that I created.
Yeah.
With the help of someone I'll keep secret. This is from the ALERT program, which was developed in the United States by Shelley Schellenberger and her colleague. I designed these, these are just emojis you can get from, you know, the internet or whatever. But this is a very simplified way to see how aware a kid can be of whether they are in a high state of being overloaded and they're getting really, really angry and losing control and can't come back. So being aware, so asking kids, how's your engine running? How are you feeling? And this is very simple to point, oh, I'm feeling a bit like this, worried or distracted. I'm feeling fine, just right. Or really, really tired and overwhelmed too. So, but this is more the overload. So the first thing, I suppose, is to get kids to have a bit of an idea of where they are, you know, and how they're feeling, the awareness of their levels of up, down, or just right.
Sure.
You know? And then getting kids to breathe, okay, and just to stop and breathe. And if you're starting to see your kids starting to get a bit overloaded, distract them to do an activity, a movement activity that involves deep pressure, deep breathing or rhythm. So for example, jumping on the trampoline, crashing, swinging, going outside. Get the kids outside, you know, off the screens, outside.
Yeah.
You know, like I say this every day. Off the screen, outside. That's the best advice, and breathe, okay? If you're able to do that, and believe me, I've been able to recommend this and prevent many, many meltdowns by that simple thing. I can see your engine's going up. Let's go outside and have some fun. Go to the park. Before you know it, kids come right down. So being aware first, okay? If you're finding that you're really struggling with that sort of stuff, then see a therapist or something like that to help with gauging the specific sort of sensory profile, what's really triggering the overload, because it could be a general noise thing, or it could be a bunch of different types of sensory inputs that is difficult to pinpoint, you know. So like things like, you know, clothes and stuff like that, brushing teeth, brushing hair, stuff like this that really needs like a sensory program by an OT. But at home though, looking at engine states, high, low, just right, outside, off the screen, movement, breathing. Okay, get kids involved in extracurricular activities as much as possible. Swimming is very good too, because it encompasses all those sorts of things. And I'm going to throw it in with ADD as well, ADHD rather, or mixed combined variety. It's the same sort of thing. These principles work with most difficulties, whether you have a diagnosis or not. It's not so much about the diagnosis as such, I see, Jess, as more of what is going on underneath all of this that's affecting what's happening. And that's what you look at in therapy, and I'm sure that's what you look at too when you're doing your stuff, is looking at what's going on underneath all this to affect things the way they're going, and what do I need to do to bring them right down. Okay.
Yeah. Perfect.
Yeah. So yeah.
What do you think in these overwhelmed states, okay, where the child has reached their limit, they're in overwhelm, what is the worst thing a parent can do in that time?
To yell at them, to yell at them back, to say, stop doing that. What do you think you're doing? Time out. It's not going to happen. Anything like just leave them alone. Like throw some cold water on them, chuck them in the cold shower, hose them with a cold hose. You've got to shock the neurological system, okay? Trying to stop them from going through overload is the worst thing to do, because it will get worse. Someone will get injured, a wall will be punched, something like that will occur. Sometimes though, like a real tight hug helps some kids, but not always. That can actually lead to a greater overload if you don't have the right pressure, because kids kick and scream and they won't remember because they're in that shutdown overload state. So trying to fix the problem is not going to work in any traditional sort of way. Keep the environment safe, and if you can at all, try to use cold water to shock the neurological system to get out of that state, and it really does work wonders. Okay. Right. Yeah, I would just hose kids.
Yeah. Okay.
Hose them.
And I guess so. In your 27 years, Deb, you know, you could probably go on and on about the children that you've been able to help and the main changes that you've seen. So actually, why don't we start? Has there been one case that's really stood out for you, or something that's really surprised you, that, you know, still to this day it's impacted you greatly, and you can't believe that how well they did and the goals they reached?
Oh, look, I'll talk about two, I suppose, that just quickly come to mind. One is a kid I just saw this week, and one is a child that I saw a long time ago, and I'm actually currently seeing his younger brother. But anyway, I'll talk about the kid that I saw just recently. This particular child came in pre-prep, massive sorts of sensory issues, anxiety issues, wouldn't speak, nothing really was going on communication-wise. And that little girl came in, and, you know, I think I'm a pretty good assessor, and I think I do a fairly good job, but I really struggled this particular day. And unfortunately, she wasn't able to really communicate with me very much. She got into more of a fetal position and cried pretty much for the whole time. And it was really difficult because, yeah, so that's how she presented. And it was stressful for her mum too. And when I speak to her mum about that, she said that, yeah, that is etched in my brain. And same with me too, you know. So because, I mean, we obviously did the best we could on the day. But saying that, now that was not that long ago. That was probably, certainly with 6 months or something ago, maybe a little bit longer, but not that long. I just saw her this week. And if you jump onto my website, you can see the new little swing that I've got. But she got up on this massive blue cushion that I have. The people I know I use in therapy in my engine room. And she stood up, jumped onto the swing and swung. And I'm like, what the heck is going on here? And I mean, granted, she still comes in and doesn't really say a whole lot, but as soon as she starts moving, she starts talking, you know, and she's going really, really well. She engages with me. Sometimes she'll tell mum to leave the room. She's actually more engaging than her sister is now. And when her sister came in one first treatment session, she was actually helpful to get this little girl to communicate with me. So that's a real standout. And that's from purely looking at sensory issues, okay? She has not been diagnosed. I think that most of her issue is anxiety, okay? Stemming from sensory processing difficulty.
Sure.
The other one is a boy who I think I saw him when he was pretty young, 5 or 6. And now this young boy, he came in with a diagnosis of ASD, sensory issues, behavioural issues, fine motor issues, social issues, lots of issues, okay? He was very challenging. Today, his mum told me very proudly that he goes to university now and is studying the thing that he was so interested in, which is computer gaming, okay? So he's doing that degree at QUT and is doing really, really well. So that's fantastic to see. I must say one more kid, because I saw this kid when he first came in. He was extremely challenging. He was uncooperative. This particular boy now is an amazing swimmer in the Special Olympics. He trains across the road from me. He is just amazing, and he works part-time. He's finished school. You know, he's done all these things that have blown my mind that I did not expect to happen. And, you know, to be part of that journey, particularly of the kids that are young, and then you hear when they're adults, is why I do what I do. Like, it just gives me shivers just even thinking about these children, you know, that I had the honour to be part of that journey and, you know, and part of that family process. You know, it's pretty cool, you know.
Yeah, absolutely.
You know, awesome.
How is that possible?
Yeah, I guess. Yeah.
I'm so glad you shared those stories, because we get really caught up in the current age of our children and the current issues. We often do not see out of this bubble that we have around our head and around the current issues that we see on a daily basis. And so those stories of when, you know, children, they can make it and they can be okay, and they probably will be okay. Just right now, it's all about supporting them in the best possible way. So they were the perfect story. So thank you for sharing that.
Oh, it's a pleasure.
Yeah. And I guess from your point of view, Deb, I'd love to hear if, you know what I do. So I work, you know, use yoga as a form of therapy with children with special needs and trauma and anxiety. So I'd love to know if that's something that you recommend for parents, and if so, what is it that you see the benefit of that being? Because sometimes we can complement each other quite well. So in your view, how does that all work for the children that you work with?
Yeah, well, definitely. And, you know, I'm probably the biggest skeptic out there. You know, I only recommend things that I know are going to work. And when I heard you present at the conference, I thought, this chick knows what she's talking about. Sorry to talk like that, but you really knew what you were talking about. You were talking about neurology, you were talking about introspection, and you were also talking from your own experience. So when you were talking about those three components that I go on and on about every single day that I know work, from evidence-based therapy and from the Sensory Processing University in Colorado, all this information comes out of deep pressure, rhythm and deep breathing. And you do every single part of that in yoga therapy that you do and your breathing that you do. I've recommended a few kids actually to come and see. I'm not sure if they have yet or not, but certainly it is something that I found there was just no one who was doing kids yoga. I'm like, why not? You know, because a lot of the time parents will say, what can I do? What can I do outside? Like, what is an activity that is going to help your child self-regulate, you know, on a long-term basis to give them a skill that they enjoy. And yoga is one of them, you know, and what you do is essential to that follow-through and that ability to self-regulate and also to improve sensory processing function, you know. I mean, sensory processing skills, sensory processing difficulties don't ever just go away, but they do improve with integration and the ability to regulate yourself. So the yoga stuff is brilliant. As is swimming and things like this. But having an avenue like that, it's just perfect, you know. Like, I was like, this is great. So that's why I chatted with you afterwards. Otherwise, I wouldn't have bothered.
Yeah, and I appreciate that because I'm quite similar. So thank you. And yeah, I appreciate your kind words. And absolutely, I see the benefits that I'm seeing right now with the children I'm working with is just so amazing. And to see, I guess, the sparkle in the parents' eyes, so to speak, you know, that, oh my gosh, my child never, ever discusses their emotions or understands what's happening in their body. And here I am with pictures of that. And then, you know, moving them from up here to down here, you know, is just, it's incredible. And I, like you, I'm very fortunate with the work that I can do and those results that we can achieve. So, thanks.
Oh, it's fantastic. So, you know, I really wish you well with it all because
thanks, Deb.
I just know that it works. It's evidence tells us it does. So,
awesome.
Excellent.
Thank you. Thanks.
You're welcome.
I guess before we wrap up, Deb, is there anything else? Actually, no, there was one other question that I wanted to ask you before we end with the final question. But has there ever been a scenario where it hasn't quite gone the way you wanted to, and that you felt as though something, it wasn't going to be okay, I suppose? Has that ever happened in your 27 years working with kids?
Yeah, for sure. It has. You know, I'd be, you know, lying if it didn't. And, you know, there's been a few kids, not a lot, but there's been a few that I haven't been able to reach, you know. There's one particular child, and I won't give the gender away at all, but one particular child, it may have been age-related, sort of that cusp of 12, 13, behavioural difficulties. Now, I knew that this was sensory stuff. I knew that this child probably was on the spectrum, but I wasn't able to, even though I became highly recommended and stuff, I wasn't able to make changes with this kid, you know, and I think what it may have been was obviously the kid didn't want to change, and at that age it's hard. If there's a shift that doesn't want to happen because it's too scary, then that can be part of it, you know, that could be part of it. You can't control all dynamics either. You can't control all home environments, and you know, there's a couple of home environments to deal with as well as the school environment. So there are a lot of components like that. So yeah, I mean, not always, you know, but that would be the rare case, you know. I'm pretty, you know, I don't give up easily, and particularly with therapy, other things I'll give up, but with my therapy, you know. But there have been a couple of kids like that I just haven't been able to shift, you know.
And I think you've probably pinpointed some good points there, is that you know, when we want to go and see an OT or another therapist, the families, the home environment really needs to be just as supported and supportive. We really need to be the school environment as well. They need to be kept in the loop. You know, I know that I communicate with teachers in schools and other practitioners as well. So we're always got that consistency. And then obviously, you know, with your relationship with the child, they're really, you know, you're absolutely, I can feel that you would never give up anyway. So I can feel that from you, that determination. And that connection with the child too is so important as well as a practitioner. That's, you know, that's key often. So, you know, you've alluded to some really critical factors there, that it's not just about the practitioner. It really is about the whole world around this child and how we're all working together. That's really important to realise.
Yeah, it's really important. You know, you can't come along and see a therapist and just expect that, you know, wave my little magic wand and everything's going to change. You know, everyone has to come on board with it, you know, and so I guess I'll just leave it at that, I suppose. There are a lot of components, but you know what, if you're motivated and you know what you want, and then anything's possible, really.
Absolutely. So I guess with that being said and everything we've discussed today, Deb, is there anything that we haven't discussed or mentioned that you really feel like is a key message or key information for parents with children on the spectrum, ADHD, behavioural difficulties, or, you know, any sensory issues, just any piece of key information that you seem to be repeating time and time again, or that we haven't mentioned today?
Absolutely. I have a massive motivation to try and change screen time. Okay. Now, I know people go on and on about it, and for good reason. I've had a couple of examples over the last little while of kids that have gone off screens and their behaviour has changed amazingly. You know, getting off all that sort of stuff. I mean, I know that it's not easy to start off with, but that's the main stuff. Get off screens, get outside, breathe, go to nature. That's the sort of stuff that we forgot, that people are forgetting in this busy, busy world. Don't overschedule your kids, you know, let them just be bored. Say bored, okay, now what can you do? You're not the entertainer for them, and neither is the phone either, you know. And I know, look, it's easy to do, and it's okay to do that every now and then. Don't get me wrong. You can't be a perfect parent, and no one is, for goodness sake. I mean, I certainly wasn't, you know. So, But to reduce that as much as possible, to reduce it as much as you possibly can would be really, really good. And just play with your kids, you know, get down on their level and play with them. You had them for a reason. Let's play with them, hey? Spend some time with them. Know that they're loved, and that whatever they do is okay because you've got their back, you know. And that's the sort of message I wanted to send out there, I suppose, really, given the opportunity to, Jess. So off the screens, outside, breathe, have fun with nature. Get down your kids' level and play with them. Okay.
Perfect. I don't need to say any more. That's just that's perfect. Thank you, Deb. Yeah, perfect way to end. I'm aligned with that vision and that view as well. So thank you. Yeah. And for people listening and watching, Deb, what's the best way to get in contact with you?
You can go to my website. It's probably the best way to. All the information's on there. www.dbtherapy.com.au. I do a blog as well, and I usually do it every week or so, just to update people on what I'm learning, what I do differently in the clinic, what I'm up to as well, personally as well, so people can actually realise that I'm actually a human being, and I do exist. So just, and I put stuff up there from time to time. So that's probably the best way. My phone number's there, email, etc. So, and even if I am busy and I can't, even if they're sometimes throughout my career and throughout times I can't take new referrals, even in those times, I still encourage people to contact me if they want to just have a chat about their children. You know, I'm really happy to do that. That is no problem at all. Perfect. All the information there. Amazing. It's been a pleasure, Jess. I really enjoyed meeting you, and thank you very much for asking me to talk today.
Oh, it's my pleasure. Thanks, Deb. Your information today has been really helpful.
No
And
problem.
it's just wonderful to see that there are, people such as yourself that are just the big key advocates for these kids. So, anybody watching will be able to hear that and feel that from you, and would want you on their side. So thanks very much for joining us today, Deb. Thank you.
No problem. Have a great afternoon. See you
See you
later.
later.